Have you ever gotten a blood test report back and just stared at it, thinking you need like a secret decoder ring to figure it out? Well, today we're going to crack that code. We're talking about the complete blood count, or CBC. So let's dive right in. Yeah, you know the feeling. You get that piece of paper from the doctor, and it's just this wall of abbreviations and numbers. It can feel super confusing, maybe even a little intimidating. And hey, if you've ever felt like that, trust me, you are definitely not alone. But what if we look at it in a totally different way? For the next few minutes, let's pretend that report is a case file. It's packed with clues about what's going on inside your body. And you and I, we're going to become the detectives who crack the case. Okay, so every CBC report basically tells three main stories, and each one is about a different key player in your bloodstream. So let's meet the cast of characters, shall we? All right, first up, we've got your red blood cells. Their job is absolutely critical. Think of them as your body's personal delivery service. They pick up oxygen from your lungs and drop it off to literally every single cell in your body. Next in the lineup are the white blood cells. Now, this is your immune system's army. They are the defenders. Their whole mission is to seek and destroy invaders, things like bacteria and viruses. And rounding out our top three, we have platelets. I like to think of them as the emergency clotting crew. If you get a cut, they're the first responders rushing to the scene to form a clot and stop the bleeding. So there you have it, the delivery service, the army, and the emergency repair crew. Simple enough, right? So now that we've met the main players, let's start looking for the clues they leave behind in the report. We're not going to get bogged down in every single line. Don't worry. Instead, we'll focus on a few of the most important numbers that really help tell the bigger story. Okay, so one of the biggest clues you'll find in that red blood cell story is a number called hemoglobin. You'll see it on pretty much every CBC report. But what on earth is it? So hemoglobin is actually the protein inside your red blood cells that grabs onto the oxygen and carries it. And here's a really great way to think about it. Imagine your bloodstream is a giant highway. Hemoglobin, well, that's the number of oxygen delivery trucks on that highway. If you don't have enough trucks, your body just isn't getting all the oxygen it needs. Makes sense, right? But here's the real secret, the thing that doctors do so well. They don't just look at one number all by itself. No way. They're master detectives, and they're looking for patterns. The real story isn't in a single clue, it's in how all the clues connect. Okay, let me give you an example. A doctor might see your hemoglobin is low. So fewer oxygen trucks, right? But then they'll look at another clue, something called MCV. Now, don't worry about the name. MCV is just a fancy way of saying the size of your red blood cells. So if the doctor sees you have a low number of trucks and those trucks are smaller than usual, those two clues together are a classic pattern that points toward a possible iron deficiency. See? It's all about connecting the dots. Here's another classic pattern. Let's say your total white blood cell count is high. Okay, so that means your army has called in more soldiers than usual. Something's up. Then the doctor looks closer and sees that a specific type of soldier, called a neutrophil, is really high. And neutrophils, they're the frontline troops for fighting bacteria. So a bigger army plus a surge in the bacteria-fighting troops, that's a pretty strong clue that your body is battling a bacterial infection. And this brings me to what is probably the single most important thing to remember from all of this. Please, burn this into your brain. These numbers are clues, not verdicts. A number that's a little high or a little low is just a starting point for a conversation with your doctor. It is not a final diagnosis. So that leads us right to your role in all this. Being a health detective means you're part of the team, and that means knowing the right questions to ask the lead investigator, who is, of course, your doctor. So let's talk about how you can have a really productive, empowered conversation. Okay, so instead of just asking, is this normal, try these three really powerful questions next time. First, what do these results mean for me specifically? Second, and this one is so important, are there any trends when you compare this to my past results? Because think about it, a single weird number could just be a blip, right? But a number that's been slowly creeping up over your last three tests, now that's a story. And finally, number three, so what are the next steps we should consider? This is how you turn these clues into a real plan. So the next time you get that report in your hands, hopefully you won't just see a confusing mess of numbers. You'll see a story full of clues. You're not just a passive patient anymore. You are officially part of the investigative team. And really, the only question left is, what's your next conversation going to be about?